Good morning, good afternoon to everyone, depending on where you are. Thanks for joining this webinar to learn more about opportunities for the private sector to support family planning and access to reproductive health services with UNFPA supplies. I'm Ian Matthews, Director of Strategy and Communications for GBCHealth. If you're unfamiliar with GBCHealth, we are a nonprofit organization dedicated to leveraging the resources and expertise of the private sector to maximize efforts to improve workplace and community health around the world. Our events like this webinar are platforms for the best minds in global health, development, and sustainable business to come together, discover unique insights, and forge meaningful and lasting partnerships. We're excited to be working with UNFPA on a series of webinars to highlight ways for the private sector to utilize their skills, resources, and voice to support the important work of UNFPA. The first webinar in our series back in December focused on the Safe Birth Even Here campaign. You can find takeaways and a recording of this webinar on our website at gbchealth.org. Today we turn to the issue of family planning and profile the work of UNFPA supplies. Over the next hour, we will bring you presentations from three experts in the field of reproductive rights. Dr. Ayman Abdulmohsen of UNFPA's Commodity Security Branch, Dr. Meena Gandhi, Health Advisor in the Policy Division of UK's Department for International Development, or DFID, and Matthew Ruhrig, Manager of Adolescent Sexual Health at Children's Investment Fund Foundation, or CIF. Ayman will kick us off by giving a brief overview of UNFPA supplies, with Meena and Matt providing two perspectives on the value they gain from supporting this flagship program as contributors. I'll provide more in-depth introductions for each speaker before their respective slides. Before we dive in, just a quick note on logistics. If you're on your computer, you should be seeing a presentation with a slide introducing the speakers. At the right of your screen, you should also see a tray with 4 icons. Click on the clock icon to open the chat function. If you cannot see the slides or are having technical issues at any point during the presentation, just use this chat function to communicate with my colleague Maggie, who will try to troubleshoot the issue. Just a reminder that all chats are public and can be viewed by anyone following the presentation. Additionally, you've all been muted for reasons I'm sure anyone who has ever taken an open call understands. If you'd like to ask any questions of the presenters during the presentation, please send them through to me using this chat function. I'll collate all the questions for the Q&A session at the very end of the presentation. Okay, so without any further ado, let's get to the main event. We thank you very much in advance for your attention. Dr. Ayman Abdulmohsen is the Global Operations Lead in the Commodity Security Branch at UNFPA. Dr. Abdulmohsen is a medical doctor and public health specialist with over 25 years of international professional experience in healthcare management, clinical service delivery, health system strengthening, family planning, and reproductive health. He has international experience in designing and implementing primary and reproductive healthcare service delivery programs, working with governments and private sector organizations to improve performance of health systems. He has substantial program management experience leading complex project teams, setting standard operating procedures to manage program resources, and establishing and building work productivity norms. He has also experienced designing and managing USAID assistance and acquisition mechanisms and grants, as well as managing DFID-funded programs. In addition to his medical degree, Dr. Abdulmohsen holds a Master's of Science in Public Health, a postgraduate diploma in healthcare administration, and a Master's of Science in Obstetrics and Gynecology. Ayman, over to you. And I'm just unmuting you now. Go ahead, Ayman.
Thanks, Ian. And good morning, good afternoon, everyone. And first of all, I'd like to thank each and everyone who are joining our webinar. It gives us a great opportunity to talk and link with our current and future partners from the private sector. So without further ado, as Ian mentioned, I'm going to speak a little bit about the UNFPA Supplies Program. But before I start doing so, I would like just to give a very brief introduction about the situation with regards to family planning. So could you move to the next slide, please, Ian? And yes, exactly. So family planning, just to give everyone a general idea, I know that there are many experts in family planning in this webinar, but I will have to speak a little bit in general terms first. When we talk about family planning, it's very important for us to know that almost every 2 minutes, a woman dies while giving birth or from a pregnancy-related complication. Almost 500,000 babies die each year from these complications as well. Most of these complications, if we look deep into the reasons that have led to them, we'll find that they are mostly preventable. And a main factor to prevent these complications is when every woman, every couple are able to make informed decisions about their fertility, the timing and the number of children they would like to have, and the means to getting a good family planning service and information that enables them to have an informed fertility and reproductive health plan for their family. When we look around us worldwide, almost 225 million women in developing countries have what we define as an unmet need in family planning. And to be more specific, these women are women who do not want to get pregnant, yet they are not using an effective contraceptive method that would enable them to do so. Over the past period, despite a global rise in contraceptive prevalence, the contraceptive use of method, the rates in sub-Saharan Africa and many developing countries, the rate of contraceptive use are relatively low at less than 20% of women, meaning that only 1/5 of women in productive age are using a contraceptive method and are managing their fertility in the right way. And this unmet need, this persistent challenge, and this persistent unmet need in family planning results in the fact that almost 75 million women each year have an unintended pregnancy. And I don't want to belabor on this, but it's been proven empirically that unintended pregnancies are more prone to having pregnancy-related complications and life-threatening complications as well for the mother and her child. Next slide, please. Again, why are we focusing on family planning? I mean, it's first of all, family planning, it's important that I share with you that when we speak about family planning, we are not only speaking about contraception. We are not only speaking about the delay or the prevention of pregnancy. We are talking about a social behavior that the woman with her partner make based on information that enables them to live a happy, prosperous, and productive life. Family planning is central to the achievement of the Sustainable Development Goals of the UN. They accelerate economic growth. A woman who has capability to manage her fertility is more prone to contribute to the labor force. A woman who controls her fertility is more empowered at the community, social, and national level. And at the same time, of course, having access to family planning services and contraceptives reduce the probability of maternal and child complications and mortality. And of course, as we all know, many contraceptives, such as condoms, they prevent the transmission of HIV. So collectively, all of this has an impact of the global socioeconomic status and, of course, a positive impact on the environment. Taking a very, very short snapshot on the economic aspect of family planning, it's also been proven that investing in family planning yields the highest return of investment. $1 investment in family planning programs and services yields $120 savings in the provision of health and socioeconomic benefits, which is, of course, higher than any other social investment program that we can speak about. Next, please. So after this introduction, and I apologize in advance for speaking fast, I only have 20 minutes and I want to give time for questions later on. The UNFPA Supplies Program. The UNFPA Supplies Program is, a large, multilateral, multi-funded UNFPA flagship program that works in partnership with governments. We invest in our long-term relationships and partnerships with our host countries by working with them, helping them bring family planning services and commodities, reproductive health services to their populations, with special emphasis on the communities and societies that are marginalized, vulnerable, or in a humanitarian crisis situation. We are considered to be the largest UN program dedicated to family planning. Since the program's inception in 2007, we have been able to mobilize over $1 billion for the service of family planning, contraceptive commodities, and systems support. We are considered to be one of the largest contraceptive procurers. Last year, in 2016, we contributed to 43% of global contraceptive procurement. Of course, the other largest contraceptive procurer is the U.S. government under the USAID, the U.S. Agency for International Development. We invest in our convening and partnership relationship with countries. We have developed and maintained a very strong, long-standing relationship with governments that enable us to work together with these governments at the country level to work to forecast and plan and implement UN family planning service delivery, contraceptive commodity distribution, and system strengthening work that will eventually improve access to contraceptives and family planning services. Another aspect that is important when we invest in our relationship is we invest in longer-term sustainability. So in addition of us focusing on achieving short-term measurable outputs, our aim is always to invest in the institutional capacity of our host governments so they are able to allocate their own resources and have the systems that are effective enough to respond to unmet need at their country level, especially in remote area and for vulnerable populations. Next, please. UNFPA supplies partners with countries and the civil society and the private sector to build stronger health systems and ensuring access to modern contraceptives to enable women to have voluntary-based family planning services and HIV and STI prevention. We also distribute life-saving maternal and health medicines, and our focus areas are basically adolescents and youth, marginalized populations, and humanitarian and fragile contexts. Next, please. Let me take a brief stop here and go back 5 years ago, and I would like to speak very briefly here about a movement that started in 2012. At that point in time, family planning was not a global public health priority as it was supposed to be. And stakeholders from the US, the UK governments, and many public and private sector foundations and the UNFPA, they held together the London Summit to reaffirm the commitment to family planning. And at that point in time, the London Summit initiated the goal of and the commitment to provide family planning services and contraceptive services to an additional 120 million women by the year 2020. Since then, the Family Planning 2020 movement started with the focus on 69 countries that constitute most of the unmet need in family planning. So when I speak about the context of UNFPA supplies, our countries that we work in are within the 69 countries of the FP 2020 goal and movement. We provide our support currently to 46 countries that are considered to be the least developed countries, the countries that have the most challenged systems to deliver family planning services and the highest percentage of unmet need. You will see, as you see in the slide, most of these countries are located in Eastern and Southern Africa and in West and Central Sub-Saharan Africa. We also work with some other countries in the Asia Pacific, the Middle East, the Latin America, and the Caribbean. Next, please. The impact of our program, we look at it as I mentioned earlier, as an investment. It is not just funding for social good. It's not only funding for social development. It's an investment with a well-defined return on saving lives and reducing abortion. As you can see, since the inception of the program in 2008 till 2016, we have contributed to preventing almost 63 million unintended pregnancies and 24 million abortions. 19 million of these abortions were doomed to be unsafe. We have also contributed to preventing 160,000 maternal deaths and around 1 billion child deaths. 1 million child deaths. We have the potential of saving 3 billion in direct healthcare costs that could have been consumed if these pregnancies were not prevented, and the same thing with these unsafe abortions maternal morbidities and mortalities if they were not to be averted. Next, please. Okay, so what is exactly that we do? So what is our approach? Our approach is basically investing in our relationship with our host countries to establish a right-based, equity-focused health system strengthening approach that ensures that family planning services and information are provided to all the population and focusing especially on those who are in remote areas who have social and economic barriers to getting these services or who are suffering from humanitarian challenging and crisis areas. We have a very strong advocacy and convening power because we've established a very long-standing country relationship with our host countries where we work together in forecasting the need and building up the plans and the strategies for future systems support and commodity distribution based on which we work with them to implement these strategies. We have a very good and in-depth understanding of the country's family planning landscape. We conduct and we contribute to evidence-based research and data generation. We work with our partners, our funding agencies at the country level and globally to make sure that we mobilize these partnerships across all sectors and have a broad geographic footprint. We also engage with the private sector in a very expanded level. On the global level and at the country level, we work in partnership with private sector in more than one aspect, ensuring that the private sector has a strong and well-defined participation in the health system. An example of what we do with the private sector is developing and supporting an expanding country market for reproductive health supplies and contraceptives. We also work with the private sector on procuring and purchasing commodities for government and working with social marketing organizations. We also work to establish synergies across the UNFPA agencies and the UN platforms so we can have more benefit to our investments. And we join our work on family planning to establish the collective priorities and initiatives and resources that focus on reproductive health in related program areas. As I mentioned earlier, we also focus on establishing the right systems and the right leadership in emergency situations, working in multiple geographic locations where there are humanitarian crises or emergency situations. Next, please. Our strategic direction toward the year 2020, as I mentioned, we continue to work with 46 countries that are considered to have the highest unmet need in family planning. We will continue to work and prioritize countries with the greatest need and have our unique country-based support and contribution. Our focus is basically supporting these countries strengthen their supply chain management and distribution systems and enabling them to have better and more effective contraceptive procurement and distribution and data visibility systems that enable them to deliver modern contraceptive methods to their constituents. Our system is not to introduce a parallel or an introductory project-based set of interventions. Otherwise, we worked basically to catalyze country-led rights-based pathways to reproductive health supply security. Our aim is not just to achieve our short-term goals. We work basically to build the in-country relationship and capacity so they can manage these distribution and these supply chain management systems on their own. And of course, we scale up proven interventions. We bring in globally proven interventions, as well as we introduce innovative interventions that allow for scaling up the delivery of or these innovative interventions in the delivery of contraceptive methods and family planning services. The UNFPA Supplies, as I mentioned earlier, is a multilateral, multi-funded program. We receive funds from multiple donor agencies and governments. Our main government donors are the UK government, the government of the Netherlands, and there is also the European Union and other governments. We also receive funds from foundations and private sector entities. That's why we have a very strong governance structure, because we answer to more than one funding agency, and we have a very, very solid accountability mechanism that enables us to answer back and report against the funds that are being distributed and managed, and ensure that we are achieving the best value for money and investing in our competitive advantage in the provision of services and in the utilization of funds. We have a very well specified set of qualitative and quantitative targets. And because, as I mentioned earlier, it's not just about the delivery of commodities. We want to make sure that all of our commodities are quality assured. They run through very strict quality assurance mechanisms, and we ensure that we use the best procurement methodologies that enable us to buy with the best prices and to allow these procurement opportunities to our host countries to benefit from them whenever they decide to do so. Next. So, as I mentioned, we provide high value for money. We invest in our current relationship, we build on our ongoing relationship, and we also build on economies of scale, because of course our huge scale of contraceptive procurement enables us to procure contraceptives with very, very competitive prices. We establish volume guarantees with the contraceptives manufacturers, and at the same time, we partner with these private sector manufacturers to make sure that the distribution process is streamlined and no interruption in the provision of contraceptives across the world. We partner, as I mentioned earlier, with our global and country organization and government, and as you all know, UNFPA is an agency from the UN. We are completely impartial. We just aim at the social good of these countries. Last but not least, we aim at long-term investment in sustainability, and this is one of our major qualitative goals and value for money aspects. We make sure always that whatever investments we're making at the country level do not only yield to short-term results, but yield to building the capacity of these countries to manage their supply chain systems and their service delivery systems on a longer scale without the reliance on UNFPA supplies or foreign aid. Next, please. So, back again, UNFPA supplies relies heavily on establishing these partnerships, whether they are being with governments and with the private sector. So the private sector has been and continues to be crucial to our success and our reach. There are three areas that we look into the private sector as means of partnership and how we can benefit from them. And when I'm talking here about the private sector, I'm not only talking about the private commercial sector, I'm also talking about private foundations and to some extent, whenever appropriate, academia as well. So the first and important aspect is the private sector can help increase visibility of our work and our impact. And the private sector can help ensure that audience learn about the importance of family planning in general and the opportunities to invest in this area. The private sector can work with us in implementing joint campaigns and leveraging the company's distribution network to share information about the UNFPA supplies program. The other important aspect is resource mobilization. Of course, the private sector has been, and we look forward to further contribution in terms of financial resources. We receive funds from private sector agencies, and we look forward to receiving more to expanding our reach. The third option is, or opportunity is leveraging core competency and innovation and making sure that the private sector contributes, can provide business competencies, skills and ideas and innovation to support our program, especially when we look into innovative supply chain management systems and mechanisms in countries that are suffering from weak supply chain management, the existing assistance of remote and underserved geographic and population areas. I thank you very much for listening, and I hope I did not take more time, and I'm happy to answer questions whenever appropriate.
Thank you, Ayman. I really appreciate it. Please remember, everybody that's listening, to send questions through the chat function for Q&A. We already have some that have been sent through email, and we'll, again, get to those at the end of all the presentations. I'm going to turn it over now to Dr. Meena Gandhi from DFID. Meena is a health advisor on the Sexual Reproductive Health and Rights team of the Policy Division at DFID. Meena trained as an obstetrician and gynecologist and practiced in the UK and South Africa for 8 years, including family planning and sexual health. She then switched to public health and spent 12 years in India, Ethiopia, and Zambia, working for a technical unit to build local capacity in India, as a freelance consultant in Ethiopia, head of health for Save the Children UK in Ethiopia, and DFID in Zambia. She is now at DFID's head office in the Policy Division, focused on a range of issues in sexual reproductive health and rights, including family planning, maternal, and newborn health. Meena, I'm just going to unmute you now, and you can go ahead.
Okay, great. Thanks very much. Can you hear me?
Yes, loud and clear.
Okay, great. So I was just going to talk a bit about the UK's investment in family planning and broader sexual reproductive health and rights. You can do the next slide, please. Yeah. So I mean, a lot of this Ayman has covered, so I'm not going to go over it in too much detail, but we invest because really we believe countries won't be able to lift themselves out of poverty until women can decide whether and when they have children and how many. It also, DFID has a big focus on women and girls, and we feel that voluntary family planning, and I emphasize voluntary, we're not, this is about women wanting it and choosing it, but voluntary family planning is necessary to complete your education and take up economic opportunities. So it is an essential component for a country to transform itself. But we know that there's still a lot left to be done. This is just one figure. You know, adolescent girls in developing countries each year experience over 6 million unintended pregnancies, of which 2.5 million may end in unsafe abortions. So, you know, that's just one figure. There are many out there around this. Also, as Ayman said, you know, we recognize that it is a best buy in development. Next slide, please. So what do we support? Well, we support ensuring a choice of products is available through a range of services that meet different needs. And we feel that this is done best through building a functioning market for contraceptives with full coverage, and coverage as low, you know, as close to the client as possible, that offers a choice to consumers and ensures that systems will be able to continue and provide what women need for the long term. So we're in it for the long term and looking at building sustainable health systems to deliver all these services. Now, the diagram on the right is actually from IPPF, but it gives an illustration. I mean, DFID, we don't view family planning alone, really. It's within a broader package of services that include maternal health, safe abortion care, counseling, gender-based violence. We sort of cover most of the package. Cervical cancer, perhaps not such a huge focus of ours, but it comes within our broad health work as well. Next slide, please. So for DFID so far, in terms of family planning, Ayman also talked about the London Summit in 2012, and that really kick-started an international movement to increase investments in voluntary family planning. Since then, the FP 2020 movement that was established at the summit has achieved, you know, there's been quite a lot of progress. currently there's 300 million women in the world's poorest countries using voluntary modern contraception, which is higher than it's ever been. But the global sort of goals that were set at the summit, we need to do more in order to reach them. The UK is the second largest investor in family planning, and we have calculated our investments alone have resulted in nearly 7 million more women, so additional women, using safe modern contraception. We work mainly through our country programs. We have 18 country programs, and we also have some regional programs that work in this area. We also work through NGOs, UNFPA supplies, which I'll talk about in more detail. We support the FP 2020 Secretariat that was created at the time of the summit, and also other bodies that really support commodity security, such as the Reproductive Health Supplies Coalition. And together with the Bill and Melinda Gates Foundation and UNFPA, we will be hosting another summit on family planning in London this summer, to really try and push the international community to take further action on some of these really intractable problems, such as contraceptive supply chains, reaching the most marginalized young women, and meeting the needs of women living in humanitarian crises. Next slide, please. So our support to UNFPA supplies, we have supported really in two phases. Phase 1 was only in 12 countries, in fact, and then phase 2, as Ayman said, is in 46 countries. Our investment in it is £356 million from 2013 to 2020, so it's quite significant for us. And as Ayman said, the 46 countries are all countries in need, with some of them with very few other sources of external support, certainly for commodities, for contraceptives. Nearly half of these countries face conflict, post-conflict, or other crises. So it's quite a vulnerable group. And the program buys almost a third of contraceptives for the 46 countries. So, it's playing a significant role in terms of getting these women contraceptives. As I said before, method choice is critical. Without commodities, you can't deliver modern contraception. That's just a fact. And of course, in many cases, it's a recurrent cost because you need to keep on taking the contraceptive. We have been working more with UNFPA supplies on improving the last mile, improving delivery to the last mile, meaning, really making sure that the contraceptives are reaching the women and girls who really need it. And that's a challenge. It's a challenge for everybody, but that's one of the key areas that we're very interested in. But the program, as Ayman said, has had some really good results. Almost half of the 46 countries have 85% of their primary facilities offering at least 3 methods in 2013, and actually it's gone up to 5 methods in 2016. So that's pretty good figures. And 5.7 million women have been reached in humanitarian settings. Next slide, please. Oh, that's it. Thank you very much.
Thank you, Mina. I appreciate that intervention. Once again, just a reminder to please send any questions you have through the chat function for the Q&A for either of the two speakers, Ayman or Mina. We'll now turn, last but not least, to Matthew Rohrig. As manager of adolescent sexual health at SIF, Matt oversees SIF's investments in user-controlled family planning and reproductive health choices. He joined SIF with a background in strategy consulting, having led teams at FSG advising pharmaceutical companies, large foundations, and NGOs on strategy and business planning. Matt also led business operations for a social enterprise, building a chain of maternity hospitals in Kenya, and founded a startup focused on affordable medical imaging services in East Africa. He holds an MBA from Oxford Said Business School. Matt, I'm just going to take a moment to unmute you here. And with that, you can take it away.
Thanks so much, Ian. I'm excited to share just a brief overview of SIF and why we invest in family planning. And then I'll talk about the different ways we've worked with UNFPA supplies and some of the early results that we're seeing from that work. So we can go on to the next slide. CIF is a private foundation founded by our co-founders, Chris Hone and Jamie Cooper. We were created 13 years ago, and we'll talk a lot about adolescence in this presentation, and CIF is in its own right entering its adolescence, just into its teenage years. So from our headquarters in London and also our offices in Nairobi and Delhi, we support issues affecting the health and well-being of children broadly, from climate change to protecting against unjust institutions like child marriage and forced labor. But in particular today, I'll talk about some of our work within our Survive and Thrive portfolio, which includes nutrition, maternal health, and adolescent sexual and reproductive health, which is where I focus. And in reproductive health, our goal is to support young women and girls to have access to the range of tools needed to avoid unintended pregnancy and have a healthy second decade of life. We have 3 pillars to our strategy. The first is user-controlled choices, both in family planning and other areas like HIV self-testing. Second, user-centered design, making sure that young women can receive services on their terms, fitting their needs. And finally, a focus on advocacy and policy change and making sure that we're engaging youth in those processes. So on the next slide, Ayman and Mina did an excellent job of walking through the nature of the problem. And as a backdrop here, our founder, Chris Hone, is a highly successful hedge fund manager, and he's one who's always looking for opportunities to make big bets that deliver high returns. And what we see here is a massive population, a massive burden, and known solutions that work and are highly cost effective. And so in family planning, particularly for younger people, he has really found an exciting big bet. We currently have about $80 million invested in our adolescent sexual health portfolio, and we see this growing over the next 5 years. So turning to our work with UNFPA supplies, they've really been a crucial partner in our adolescent sexual health team. I'll speak briefly to 3 ways in which we've interacted with UNFPA. And you heard from Ayman about the breadth of functions that the program offers, and that holds true in our work as well. So first, in our work on contraceptive implants, UNFPA's procurement funding has been pivotal in unlocking broader change in market dynamics. Implants protect against pregnancy for 3 years. Many women love it as an option, but 5 years ago, high prices and frequent stockouts limited its availability. So CIF and other funders entered into a unique agreement with major manufacturers to cut the price of implants for countries in need in half. We were willing to take those risks, put up funding from our balance sheet to guarantee sales volumes, but to give us the confidence to move forward on that, we needed commitments from major procurers, and perhaps even more importantly than the procurement itself, the nuanced understanding of countries' plans for procurement such that we could embark on this effort. And UNFPA supplies gave us both. They gave us the understanding of the demand for the products across the 46 countries where they work, and they committed to procuring millions of units, which helped facilitate the price reduction. This resulted in just a phenomenal change to the family planning landscape, where millions of girls and women could have access to this long-acting option that was inaccessible previously. Second area that we've worked with UNFPA supplies on is around our direct support to them, facilitating the introduction and scale up of another long-acting contraceptive, an injectable that provides 3 months of protection using a smaller subcutaneous needle. This product, which as manufactured by Pfizer is called Cyanopress, also offers the potential for some women to elect to inject themselves at home rather than traveling to a distant health facility several times a year. So we supported UNFPA in 3 countries, Nigeria, Burkina Faso, and soon to be Myanmar, to accelerate introduction of the product, train healthcare workers, and ensure an efficient supply chain. They've been extremely effective at working with governments, and we've found their country teams to be very well respected by health authorities at all levels. And they've also displayed a remarkable ability to keep a total market approach at the forefront. So thinking, of course, about the vital channel through the public sector, but also incorporating the private sector where relevant to these countries to make sure that there's long-term sustainability there. And then the third area, while the focus today has been on the UNFPA supplies program, we've also been impressed by how other teams within UNFPA link effectively to the work of UNFPA supplies. And in Kenya, on one of our major investments in family planning service delivery, we've had the pleasure of working with some of the UNFPA technical colleagues on technical assistance and implementation planning. And our implementing partners there have really benefited from that range of knowledge on supply chains and service delivery channels, again, on both the public and private sector side. So on the next page, I've already alluded to some of the returns that we've been seeing from these investments, both in and alongside UNFPA. But where we really see their value add is linking this hands-on technical advice with the large-scale pooled procurement. There's just a real force multiplier at work there. And when we look at every SIF dollar that we put in, ultimately leveraging at least $2.50 in additional procurement commitments made possible through this larger procurement pool, that's just real value for money in our perspective. And UNFPA has this power to give contraceptive supplies markets confidence in large orders, and through that, engage in market shaping activities that then drive further cost effectiveness. So there's a nice reinforcing cycle there. So thanks for the opportunity to share some of our work, and looking forward to questions and hearing more about what's next for UNFPA.
Thanks, Matt. I really appreciate that intervention. So we will move. We have a few questions that have come through, and I'll direct them to a few different folks that have given presentations, and we'll unmute them as I ask questions. First, for Ayman, there's a question that just came through about UNFPA working outside FP 2020 countries, such as countries in Latin America and the Caribbean that have high inequality in terms of access to family planning. Can you talk about any plans to work outside of the FP 2020 countries or the 46 focus countries that you referenced in your presentation?
Sure. Well, first of all, thank you for the good question. Our drive is mainly to respond to the global unmet need. So prioritizing the 46 countries that constitute most of this unmet need does not prevent us from working with other countries. In a case like this, if a country in the Latin American region, if they have a strong case, we normally are open to discussing this. We present it to our governance structure, and a decision is being made by our steering committee. And once the process is being agreed upon, we normally provide them with the support they need. So conceptually speaking, yes, we are open. It's just a matter of using our available funds efficiently by prioritizing on these countries.
Thanks for that, Ayman. I'm actually going to unmute all of the speakers right now. So if you're one of the speakers, if you're not speaking, could you just mute yourself on your side? I think that will make it easier for the question and answer session. So a question that I'm going to throw to Mina, but maybe the others would like to chime in as well. So the question is, what is the gap between Mexico policy and 2020 family planning objectives? And really, what is the most urgent objective, and how do you prioritize within DFID? But I'd like to hear from the others as well afterwards, how within their organizations they're prioritizing this variety of issues within family planning.
Hello. Yeah, that's a difficult one. I mean, I think we're just continuing our support. I mean, we've been supporting. We work a lot with the U.S., with the Gates Foundation, with UNFPA, with others on this, and we continue to be strongly committed to this issue. The biggest focus area, I would say, I mean, some of the things that we want to target in the summit in the summer, we feel are some of the biggest areas where that need focus. Supply chains is a big one. Being able to get the supplies to where they need to be, and that, these are some of the hardest issues to tackle at country level. So that is a big one. Reaching youth, reaching marginalized women, particularly young women, is a big challenge. Getting countries to even talk about it, and then deliver services for that group. And women in humanitarian crises. I mean, so often it's not part of the it may not be part of the initial emergency response, but then it's not part of the ongoing emergency response, despite there being a lot of need. So those are the areas that we feel really need to be looked at. And of course, resources. These commodities cost money. They currently they're funded by. Well, if you actually look at the breakdown of funding, a lot of them are funded by women themselves, out-of-pocket spending when they go to private clinics. And the rest is governments and donors, and how to increase the overall pot that goes to family planning and keep it a priority is a key issue for us.
Thanks very much for that, Mina. Ayman, I'll kick the question to you as well and pick up on something Mina just said. I mean, can you talk a little bit about how UNFPA prioritizes its work, but particularly within the lens of sort of the humanitarian and conflict setting?
Sure. Okay. I would like just to let me try to answer it in a different way. Let's imagine we are now talking about a young lady in a northern rural Nigeria. A young woman who's most probably got married while she was young, maybe in her late or mid-teenage, and she has so many social issues and cultural issues that makes her more prone into having many children, and the fact that she may consider that having children is good for her social and economic support. If we think about this young lady, this woman, let's look into what UNFPA Supplies program, what the global family planning community is aiming at. The global family planning community, including UNFPA Supplies, donors like the UK government, NGOs like CIF, we work together to make sure that this woman has access to good information on family planning so she can make an informed decision. And when she decides to use a contraceptive method, she have access to a cafeteria of method that she can choose from what is more appropriate for her, what she can benefit from, and what she can continue using without having the risk of stockouts. So that's what we are all about. We are all about making this woman empowered enough to make an informed decision and have access to these services. So this is how we are looking into this. Looking into all the women in the world, including those who live in humanitarian crises or humanitarian challenging issues, we try to provide them with the same set of services and information. We also focus on providing them with essential maternal medicines that are known or proven to prevent and reduce significantly probability of pregnancy-related complications, including maternal mortality and child mortality.
Thanks very much for that, Ayman. Over to Matt. So we have a specific question about CIF's work in India. Could you talk a little bit more about the work you're doing there and prioritization?
Sure, and maybe just I'll touch on the previous question and use that as a segue into some of our work in India. So CIF as a private foundation, while we're large by those standards, does not have the resources of a major bilateral institution. And so we need to think about how to be catalytic in our funding and take advantage of the fact that we can offer a level of flexibility and willingness to deal in uncertain or politically contentious waters and take on tough issues. So we really think about prioritizing our role in areas that require demonstrating new models, conducting evidence-based advocacy, and really starting that flywheel for other larger institutions to eventually take up different approaches to programming. And I think that's been a template that's worked well in some of our work with UNFPA as well. On the India side, India is one of the major areas of focus for SIF, both as an organization broadly and in particular with our family planning work. We have a team based in New Delhi that manages that work directly and is actually in the process of putting together a number of investments all focused on the state of Rajasthan and improving the full continuum of health outcomes from some early childhood indicators all the way through expanding access to family planning options among adolescents there. That is rolling out over the course of this year, so stay tuned for more specifics there. But India remains a major focus of our work broadly.
Thanks, Matt. I appreciate that. Pretty much anyone can answer this question if they like, but maybe I'll start with Meena. How is DFID prioritizing injectable contraceptives?
Well, we don't prioritize one method. Basically, we're really promoting method choice, which is one of the reasons that we support UNFPA supplies. The Cyana Press work that Matt has highlighted, we are involved in that, and again, probably in a similar way through UNFPA supplies, we would hope to procure some of the Cyana Press when it finally does get rolled out to scale. But we don't. We really are. It's really about presenting a method choice, the full range of choice, and then it's up to women to decide if they want even a natural method. That's totally up to them. I don't think that's we're really not prioritizing particular methods in our work.
And Ayman, does UNFPA take a similar stance?
Absolutely. That's. I mean, I don't want to repeat what Meena rightfully mentioned. Our approach is not to prioritize or to focus on one method or the other. Our focus is to make sure choice is there and to make sure that women have a choice within reliable modern methods, so she does not revert to unreliable methods. And we make sure that a woman has a continuous supply of whichever method she plans to decide to use. We do not promote one method against the other. And of course, we do not. I mean, with regards to injectables, we don't prioritize injectables against other methods.
So Matt, I'll throw the same question to you and take a step back a little bit. I mean, so the question is specifically about injectables, but given SIF's focus on innovation and user-centered design, how do you balance that prioritizing of certain sort of innovations over others?
Mm-hmm. Yeah, great question. So we start from the same principle that I think Meena laid out really well of 100% commitment to user choice and having a full method mix and ensuring that there is availability of that full range of options as opposed to pushing a single method. And really where the global work we do around market dynamics connects to that user-centered design idea is in starting from the perspective of understanding users and understanding women that aren't currently able to access methods that they would like to be able to include among that choice set, and then seeing what are some of the global level manufacturing or access or procurement gaps where we could play a catalytic role to bridge that divide. And so it's really about understanding those needs and then using that to galvanize action to bring additional choices to the user, as opposed to starting from the product and pushing it out, if that makes sense.
No, it does. Thanks for that distinction. Meena, did you want to?
Yeah, I just wanted to add something else. I mean, I think there's market dynamics work going on across a range of commodities. For example, the Reproductive Health Supplies Coalition that I mentioned before works on, there's a whole different range of commodities, intrauterine devices, diaphragms, but it's just some where there is a sweet spot, I guess, where you can make it more available with a few interventions. I think that's where the work on the implants and the Cyana Press has come out, but it's really about the choice.
Thanks, Meena. I appreciate that. So a really important question for Ayman that will sort of segue nicely into closing. which is what can private sector's companies do to support UNFPA? Specifically, are you targeting certain types of companies that can provide sort of complementary support to UNFPA's programs?
Well, thank you, Ian. I wouldn't say we are targeting specific companies because the private sector in general is a major player in health systems. So all private sector companies can have a contribution in the health system in general. As I mentioned earlier in my presentation, the private sector can help us expand our visibility and expand our access to the work that we do and help mobilize resources and help drive policy towards improved access to contraceptives. The private sector is also known to be very cost effective and efficient, and working with the private sector can really help us expand our reach, especially to marginalized and underserved geographic areas. The private sector is known to be very effectively functioning in many of the countries that we work with social marketing work and commercial marketing products that we can piggyback on and have some sort of a joint win-win relationship. And of course, not to belittle the opportunities that the private sector can support financially to expand our reach and to expand our support to countries. There is so much the private sector can do there, I think, and again, we are open to the innovative ideas the private sector can introduce to our work as long as it will contribute to expanding our program and our reach to those who are in need.
Thanks, Simon. I was a little unfair to you because I sort of asked you to do the closing for me at this point.
I have to do so.
I actually need to thank the person that asked the question as well. But just quickly, in closing, we hope that by providing this introduction to UNFPA Supply's team and two of their donors, that we've sparked an interest in learning more about this program. As was pointed out during the presentations of both Mina and Matt, family planning is not just about health, but about rights. Access to high-quality reproductive health services enables women and girls to finish school and reach their full potential. It also happens to be one of the most cost-effective of all development interventions, providing significant social and economic return on investment to countries and funders. However, as Ayman just pointed out and reiterated again, it's not just about money, although money is important. The private sector can contribute to family planning by helping to increase visibility and leveraging core competencies and innovation to improve procurement and strengthen national capacities and systems. I would like to extend a warm thank you to all the speakers on the call for sharing their perspectives. To our audience, if you'd like to be more engaged in this space, please don't hesitate to reach out to either GBCHealth or UNFPA using the emails on the screen for more information about this program and how you can contribute. You can also go to familyplanning2020.org to learn more. Today's presentation and audio will be available on our website in the next few days. Also look out for more information on the Family Planning Summit that Mina mentioned this summer. So thanks to everyone for your attention and have a great rest of your day.